7.4 million people in England are still waiting for a hospital procedure. How is it that the number is just so wild?
Healthcare was never organized around the patient. It was always organized around the availability of a physician. Healthcare access is an actually very expensive problem. Global healthcare spend is about 12 trillion.
Healthcare should be human right, but if you need the care now and you've been told your appointment is in 9 months' time, the free becomes irrelevant.
Our NHS is the most expensive healthcare for which we all pay. Do you know we are spending close to $220 billion plus dollars for a population of 67 million?
Let's talk about reform. We mentioned technology, we mentioned AI. Can you talk about one of your products that address these bottlenecks?
Detailed consult, a detailed assessment, a prescription, a blood test, and a registration, all within 16 minutes. It sounds impossible.
Within 16 minutes. And if this person is to go today down the traditional route, how long are we talking about?
We're talking the whole day. Every doctor is inherently completely capable of transforming this whole system. I want doctors to be that restless. I'm sure we'll achieve miracles.
My guest today is Dr. Abhay Chopada, who sits right at the crossroads of hands-on surgery, bold entrepreneurship, and data-driven innovation. Dr. Chopada is a world-class consultant, GI surgeon with over 30 years of global experience, an alumni of University of London, and a graduate of the NHS Leaders Academy Ready Now program. Tatler magazine ranked him amongst the top GI surgeons in the UK, and Top Doctors UK honoured him with a coveted Top Doctor award. And beyond operating theatre, Dr. Abhay Chopada has co-founded multiple health tech companies like Clinivantage, Axon Health, offering AI-driven patient solutions. He is an investor, he's a mentor who guides teams building smart devices and predictive models that helps clinicians stay one step ahead of life-changing conditions like heart attacks, strokes, and cancer. And today I am honored to have him on the show. Dr. Chopada, welcome to Dose of Health.
Thank you for your very kind words. I hope I justify part of that introduction.
I'm sure you will. Let's just dive straight into it. 7.4 million people in England are still waiting for a hospital procedure. How is it that the number is just so wild that you just can't even comprehend?
Healthcare access is not a unique problem to the NHS. It's actually a global problem. However, in UK, we feel it much more acutely because we did have a good system.
Right.
Which got overwhelmed. And part of that was basically the way we've organized our healthcare system. Healthcare was never organized around the patient. It was always organized around the availability of a physician. And when you think about it, we go back about 100 years, and it was all about availability of the right skill. And doctors were held in absolute, on a pedestal, purely because there were so few of them. And that's when we actually had primary care, secondary care, and tertiary care. The idea was that at least by doing this, we will try to serve as many as possible. Times moved. And we went ahead with now trying to serve a much wider population with much wider diverse backgrounds. And this is where the entire system has come undone. Healthcare access is not a benign problem. Healthcare access is an actually very expensive problem. I'll put a very simple perspective on this. When you are in any kind of medical need, if I solve your problem without a delay, let's assume it'll cost me X. But if I delay it, even by a day, that cost will be percentage higher. If I leave it for 2 days, it might be double. I'll give you a very simple example so that people understand exactly what I'm talking about. Let's assume we get a chest pain. And fortunately, we do have a very good emergency service, but I'm just going to use this as an example. Let's assume you have chest pain and I have immediate attention from a medical opinion for you, or a trained professional can tell you immediately as to what you need to do. And the first treatment would just be a tablet of aspirin, which is 75 milligrams of aspirin, cost you probably less than a penny. But let's assume that we delay this chest pain for an hour.
Yeah.
Now you're going to need streptokinase as an injection in the hospital, which is at least the whole treatment episode is going to cost you at least a few $1,000 or
Yeah.
£1,000. Now you have an ambulance, you were taken to the hospital, you have to be given streptokinase.
Yeah.
God forbid, if you actually sustain cardiac damage and because you waited for more than 3 hours, the cost now is going to be a lifetime cost of maintaining a cardiac cripple.
Of course.
This is obviously an extreme example, but this also applies for chronic diseases. Let's assume you start noticing arthritis or pain in the joints, and we treat you within the first day or two, or even the first week. Much easier because the inflammation is minimal. We give you attention, we reverse the inflammation. If I delay this access, even by a few weeks, now chronic inflammation set in. And now, again, it's going to be almost impossible for me to restitute to normal. So we have to start thinking about health from an access perspective. And there is actually very good economics around this. Global healthcare spend is about 12 trillion. And some smart figure at the World Bank did a study to find out how much does delayed healthcare access cost us. How much money are we spending, which we could have avoided if we gave immediate access to healthcare?
Yeah.
Guess what that number was?
Do you want me to guess?
Yep.
Oh God, I can't even think.
We raised $6 trillion, 50% of the cost.
Wow.
It's taken purely because we do not give timely access. We are not even talking suffering and productivity loss here. We're
Wow.
talking about direct cost of care. So then now let me come back to your original question. Why is the NHS so bad at the moment?
Yeah,
Really, there's a combination of factors. So first of all, our population has grown over the last several years, but our NHS bed availability and secondary care expansion has been absolutely minuscule. If anything, we've contracted that space.
Right.
We were hoping that that will make the space more efficient. What it has done is actually counterproductive. It has actually damaged efficiency, not made it more efficient. When I look at the bed availability per capita, let's say how many beds do we have for 1,000 people in UK? The number has gone down, not gone up. Combine that with the fact that we've had a lot of changes in the way primary care was delivered. And suddenly the problem becomes absolutely unmanageable. Because GPs who used to offer 24/7 care now offer you a 9 to 7 care. Suddenly, after 7 o'clock in the evening, if people who are desperate to get some attention, and we had assumed that by offering an 111 service, we'll be able to sort a lot of this problem. See, human beings are tricky. Human beings don't depend only on a telephone call. They want to be seen by someone, even if it's a minor problem. What was the net effect? Patients started thronging the A&E departments, which became doubly busy. But in the process, they started utilizing resources, which were very expensive. And now we have a domino effect. We have the same problem compounded many times over because we never address the core issue, timely access. As I said, we have a very rigid system of primary, secondary, and tertiary. When I look at a country like India, I'm amazed as to how different India is. India no longer has a primary, secondary, tertiary when I look at the private sector. An average Indian patient will directly go to a specialist based on his need. So if I've got a earache, I'll directly go to an ENT surgeon. I'll not go to a primary GP and hope that he'll be able to help. If I'm pregnant, I directly go to an OBGY. If I've got a headache, a lot of the time I might not even go to an internal medicine guy. I'll go to a direct neurologist. And what we've seen here is the outcomes are so, economical. And they really have transformed. And that's why Indian healthcare is now progressing so fast. So when we look at NHS, we really can't say that only our system is the best. We have to start learning from every system around the world, which is progressing at its own pace. I know I've given a very lengthy answer, but back to you.
No, it definitely makes sense. I think from what I'm hearing is timing really matters, and I absolutely agree with that. And the domino effect of the bed availability and their patients who are fit to be discharged. There's also like the social care aspect of it, where some patients are fit to be discharged, but they can't really go out in the community because the package isn't in place. Classic problem with aging population. But if we were to stick to surgical care, Dr. Chapada, what do you think is going well in the NHS, and where do you see the biggest cracks showing in terms of trying to bring the 7.4 million waiting cases down?
So again, a very interesting question. Let me first address a point you made earlier.
Yeah.
The demand is going up because we've got an elderly population. And we also have an immigrant population that doesn't communicate very effectively,
Mm.
which actually will use a lot more resources. The NHS today is still the envy of the world when it comes to emergency care. And I
Right.
can keep a hand on my heart and say, listen, if there's an emergency, I would rather be in England than anywhere else in the world. The reason for that is I get timely access to care,
Yeah.
despite the misgivings and having to worry about cost. However, there is a dark side to this, that if I'm
Mm.
unlucky enough to get missed or not triaged adequately, I might be suffering and even lose my life,
Mm.
which are horror stories that come out of the NHS almost on a regular basis, right?
Yeah.
How do we address this issue of the long wait? And again, actually, it's very simple. We have to stop for a moment and start looking at what the heck is a medical consult. Do
Okay.
we have to continue with the model of medical consultation that emerged more than 100 years ago? Can we create efficiency tools that actually will make the system better?
Mm.
But most importantly, can we create something that is joined up properly and not as a piecemeal solution? What I see in the NHS is a lot of small solutions that actually harm efficiency rather than help efficiency.
Mm.
You've got an EMR here, then you've got an app that does something else, then you've got another app that does something else. And universally, when you speak with the clinician, he'll say, listen, this was just dumped on me. I didn't ask for it, but the higher ups actually asked us to use it, so we are using it. That's not the correct way. If we want to start looking at how do we address healthcare efficiency, we have to do something very simple. Start looking at what is a medical consult. And the answer is actually very simple. It's a data analysis. It's nothing more than that. When I actually look at what is it that I do during a medical consult, I start by taking history, which usually consumes about 60 to 70% of my time. But is that history really going to change if I get it at home? I take it in the clinic? No, it's
Mm.
totally what the patient is going to tell me. My questions are going to be very similar.
Yeah.
Why can't I use AI-driven tools that will take my medical history at home and present me something that I really need to just quickly glance and understand and start examining the patient?
Mm.
Why can't I have tools that helps me avoid any mistakes or avoid taking any shortcuts? So it will actually focus my mind to say, oh, I have to do this. 15% error rate in medicine.
Wow.
It frightens people. This is not my number. This is a global figure, 12 to 15% of error rate in medicine. Now, if you actually offer tools to the clinicians, whereby they actually get the information that they need in real time, it can
Yeah.
completely change the game. Let me give
Mm.
you a very simple example. So we built an app at Axon Care, which is your dynamic real-time medical file,
Yeah.
available 24/7, 365
Yeah.
in any language, which is updated automatically at the end of any consult without the doctor having to do anything, without the patient having to do anything.
Yeah.
It updates every time you get a blood test or a CT report. Now, what you do is the moment you do this, you now have access to the data, and now any clinician can take over from a previous one,
Mm.
which means that now I can go to any clinic, see any doctor, and I'll still have the same standardization.
Right.
That is where the key lies. Today, elderly fragmented care is the main reason why we are so expensive and so difficult.
Mm.
Fragmented care has been a problem ever since we built primary, secondary, and tertiary levels. Because we never joined them up. We just
Yeah.
hoped that they will talk with each other.
Yeah.
And that communication piece is sadly missing.
I couldn't agree more. So I work in HIV healthcare. HIV in the UK is a very specialist service. Now, this population is aging as well, and they access HIV specialist center, they access their GP, they access other specialist services, they buy stuff online, and literally every single places where these people are accessing care, they all have their own data and they all have their own affair. And if the patient doesn't consent, no one talks to each other. So the amount of drug interactions that I find after they have happened, the amount of side effects or gaps in care that we come across after the effect has happened is just very clear to me. So what I'm getting from you, Dr. Chopada, like main issues seems to be data scattered and there is lack of time or time is being misused into things that can be done by machines. Would that be a good summarization?
You're so right. So data now is the key because if I get the right information, I'll make the right decision. But
Yeah.
why are we still depending on humans to acquire that data or to collect that data? Why can't we use technology and make that data available? So let me put a very simple example in front of you. Healthcare today is what banking was 40 years ago. Extremely fragmented, very expensive. Every bank was a brick and mortar. You had to physically go to the bank. Very little happened without you having to go.
Yeah.
What did they do? They built a backend system where all your financial data moves in real time. Even if I withdraw $10 in New York, immediately my UK bank account will make a note that yes,
Yeah.
yes, you've withdrawn $10. And
Yeah.
that is the making data mobile from any source that's connected. That's going to affect. And that's what we've built really. So
Mm.
data mobility will transform healthcare. And by integrating tools with this data mobility, especially leveraging AI, giving it the right kind of information, it's an
Yeah.
extremely valuable tool.
Absolutely. Let's talk about AI, Dr. Chapada. I speak to a lot of healthcare professionals, and no doubt people are stressed. And healthcare professionals are very good at summarizing the problems because they deal with it on a day to day basis. They share your concerns about the lack of time, they share your concerns about data, but it feels like the conversation really just stops there. And people then just carry on with your day-to-day life. I'll do whatever I can. But there is this another world that is being created quite fast, very rapidly around us or parallel to us that seems to be claiming that healthcare will be disrupted. So, for people, for healthcare professionals, or even patients who don't really understand what AI is in a very simple language, how would you explain it to healthcare professionals?
Again, again, our romanticism about healthcare is going to evaporate very fast.
Mm.
We have always assumed that we need a human touch and the doctor is going to have a lot of time for us and is going to be very empathetic to us. What is the reality? The reality is this doesn't exist. You go
Yeah.
to a clinic and the clinician his only concern is, oh, I've only got 10 minutes. I better finish this. I have another 20 patients to see.
Yeah.
And the patients end up frustrated. So
Yeah.
this concept of the doctor having leisurely time and giving you human empathy was
Yeah.
long dead, right?
Yeah.
Today, I don't even see the same doctor twice. There is no continuity of care. Now, the younger generation also has another problem. They're hugely mobile and they're very time starved. So a lot of the times, even when they have a health issue, purely because they are so time starved, they don't go and seek that attention.
Mm.
Purely because they have to waste a lot of time in order to
Mm.
seek that.
Mm.
So when you talk about these parallels that are happening, I'll tell you technology, the younger generation is very tech savvy. And they don't want to wait. They want everything now, the Gen Z.
On-demand economy, yes, the
Yes.
on-demand consumer.
I'll tell you a very interesting parallel that had happened about 15 years ago when Google was new.
Okay.
I still remember people started searching all the symptoms on Google, and I started seeing a lot of people who actually came to me with a diagnosis. They said, Doc, I've got XYZ because I've Googled it and that's what it says.
Right.
Most of the time they were wrong,
Dr.
right?
Google, yes.
Because there was no context.
Right.
So when you talk about AI is going to do exactly what Google did. If you don't provide it the context, if you do not have everything about that patient, in a contextual fashion, you're not going to be able to leverage current technology to give people that access to care that they're really so desperate about. So
Right.
when we built the platform, we integrated AI. The first thing I've done is ensure that the right data is available for context, that the
Right.
patient controls his or her own data. And once you do that, then you can leverage any technology. And then the doctor's role becomes supportive rather than that of leadership. I don't think that any doctor has ever cured a patient. And I say this with a little bit of humor. And I'll tell you why I mean what I mean by that. Doctors actually will just guide the patient's body to heal itself. The healing has happened by the body itself. As a surgeon, I merely damage someone, but the healing then gives me the result for which the damage was intended. So when you look at it from that perspective, you'll realize that actually our body is designed to heal. All I need to do is support the body during that phase and give you the right advice. And that can be done so much better with integration of technology. Because, I have absolutely no doubt in saying the future is already disrupted. Healthcare as it is going to evaporate so fast that people are then going to say, oh, did you have this like this? You
Yeah.
waited for a whole 4 hours for a 10-minute appointment?
Yeah. Weeks sometime,
Yeah.
Dr. Chapada, to meet the GP. I mean, I hear you. I hear you. I think I have felt it where we've just not been able to get the GP appointment when we need it. Or like surgery times, like I'm saying, there are about 100,000 patients or something crazy I heard have waited for over a year to get a surgery. And imagine somebody sitting with a tumor in their brain, waking up every day, just hoping that they will get called. I'm sure people 10 years from now are going to be looking at this and going to be like, what the hell were we doing?
Absolutely. Let me put it in another way, Abhishek,
Yeah.
and I'll tell you because I've given this a lot of thought. People have already started. So the biggest segment in private sector I see is self-pay patients, which is a
Self-care
big
patients.
self-pay patients.
Yeah. Yeah.
So this is a big, in fact, it is something that every healthcare service should look very carefully as to why are people spending money when we've got a free healthcare service?
Yeah.
That is because they're desperate,
Yeah.
right?
Yeah. Yeah.
Now, let me put an analogy in front of you. Let's assume I'm feeling hungry
Yeah.
and there's a restaurant next door and I go there.
Yeah.
They say, yeah, brilliant. I'm going to serve you, but your food is going to come to your table 4 days from now. I'm going to hate it. And it's very similar when I'm unwell. I really need the help then.
Yeah.
I'm not worried about 4 days down the line when the GP is available.
No. No.
So what is going to happen? And I'm going to make a very bold prediction. I'm going to say that healthcare is going to get globalized. You
Right.
might have a GP in Australia who's consulting a patient in UK. And
Right.
these artificial barriers that we've created over the years,
Yeah.
saying that, uh, African healthcare system is not of our standard. That was a very
Yeah.
artificial
Yeah.
construct created by the Western mindset. That
Yeah.
is going to disappear so fast
Yeah.
because, like I said, I've now looked at healthcare services across the globe.
Yeah.
And I'll tell you, the standards are far better in some of those less developed
No,
countries, US or UK or Australia. I'll tell you, we have to grow out of that mindset.
I agree.
Standards, what are we talking about? Is
I
when a
agree.
patient dies,
I agree.
your standard of healthcare is zero or minus.
Yeah. Yeah. Yeah.
You have to start learning from countries like Cuba, like India, like UAE. Access to healthcare is so much easier in those countries, and
Yeah.
outcomes are so superior. So
Exactly.
we have to understand one key factor that we have to be humble enough to learn. We have to
Yeah.
be prepared to say we are not the best. We used to
Yeah.
assume a lot.
Yeah. I think what happens in the UK, and this is my personal opinion, that there was a certain generation that was born in the healthcare when it was free and it was sold to you as a human right. And when NHS was initially built, it was post World War II, and it was mainly acute care, and people were just not living this longer. And now this generation has grown older, knowing that healthcare should be human right, and people are just obsessed with this word free. And it doesn't really matter how bad the care gets. The minute you even have a conversation about should NHS be free or not, there is no debate. It's always like it has to be free. And, I agree with it because healthcare should be human right. But at one point, I think people need to think about what is the use of free? Just like the analogy you gave for the restaurant coming 4 days later, that you, if you need the care now and you've been told your appointment is in 9 months' time, the free becomes irrelevant. And the only place we can,
There are real facts in front of you. Sorry, I cut you because I really want to put this point across.
yes, sir, go for it.
It is not free at all.
Mm,
Our NHS is the most expensive healthcare for which we all pay. Do you know we are spending close to 220 billion plus dollars for a population of 67 million?
yes, yeah, 197 billion pounds or something crazy like that. Yes,
Nope, it is much higher than that because we have to add all the extra layers that we've taken care of.
right, right,
Now, do you know the multiplication comes to more than, just do a back of the envelope calculation, more than 3,000 pounds per
right,
person who's
right,
well.
right.
Even my healthcare, private healthcare insurance is cheaper than that. So let's get out of this mindset that NHS is free. It isn't. In fact, it has become a gravy train for a lot of people. And one of the reasons NHS really needs radical reforms is because it has become a gravy train for which we all are paying as citizens.
Mm,
Now, let me put a very simple example in front of you. A simple operation like a hernia repair in the UK will cost you, even for the NHS, about 3,000 pounds, when you add all the layers. The same thing happens at a cost of about 600 pounds in India. Now, why is this differential existing? That is because vested interests have ensured that NHS was never reformed. I say this very boldly. Even today, when you start talking about innovation and disruption,
yeah,
they will start throwing so many layers at you. Do you have this permission? Oh, data protection. Hang on, when a life is at risk, I don't think that person is going to really care about his data privacy. But there are people who've usurped that, taken those little tools to stop innovation, to
yeah,
stop any reform of healthcare. And they've done it in such a clever fashion that it beggars belief.
yeah,
Ask any person who's suffering that what do you care more about, getting better or your data privacy? He's going to say, just get me better. I don't
yeah,
care whether you know everything about me.
yeah.
So
It's a,
we've
yeah,
created all those bugbears without, I'll tell you, this is actually a very cruel way and a very cynical way we have actually created these rules. I don't
yeah.
think data privacy was ever put as a referendum to the citizens of UK. So how did the government automatically assume that data privacy is such a big issue? If it is
Mm,
my data, then I should be asked whether I want to share it or not.
yeah,
The government automatically assumed that no, we have to protect everyone's data. And the
mm,
reality is no one's data is protected. Today, my data is more available with Google and Facebook. So what did the government do there?
yeah,
Did the government help me or fail me? It failed me. Not only that, what it is doing is using those, what I call as artificial ways to stop innovation, stop reform.
yeah,
And it is done by people who have vested interests. I'm very clear on what I say,
yeah.
simply because I feel very strongly about it.
Of
I
course.
feel that people are suffering because the greedy people are
Yeah.
stopping reform.
Yeah, I think you're right. I think bureaucracy, people who are just completely resistant to change, and way too many people in the NHS that are decision makers rather than actually people who want to make a change, you know?
A silver lining. So when you now hear about recent comments from the top leadership of the NHS, which is our health minister,
Yeah,
I'm
frustrating.
very pleased to hear that actually he is the one who dismantled the NHS Indian structure.
Mm,
He is the one who's saying, listen, we have to reform.
yeah,
There's no doubt. So I
yeah,
think for the first time in many, many years, I can see that there's a push from the top.
yeah,
There's still going to be a battle with a lot of middle layer.
yeah,
And there has to be very open debates about this. I don't think
yeah,
it's going to be my view or your view that's going to matter. But we
yeah,
have to put this in public debate.
of
We have to
course,
start taking people's opinion about how do they see the future of healthcare.
of course.
And we have to reform based on what. Because healthcare is life. Healthcare is not an add-on. Healthcare is not an option.
Yeah, you only have one heart,
Yes.
one brain. Okay, you know what? I think we've laid down the problem absolutely brilliantly. I think we both agree, and I'm pretty sure the world agreed that reform is needed in healthcare. So let's talk about reform. You know, we mentioned technology, we mentioned AI. And let me tee this up for you, Dr. Chopada, because one of the main reasons why I wanted to speak to you was, unlike yourself, other doctors and healthcare professionals that I talk to mainly talk about problems and they talk about solutions, and the conversation then stops and then people go back to their day job. But you went one step further, or actually many steps further. I've seen in your resume, you also went into health tech and you started multiple companies, like the Clinivantage thing that I was saying, which was SaaS health tech company. But I'm more interested in Axon Care, which has like multiple solutions that we have spoken about. So can you tell me what inspired you to start Axon Care?
Abhishek, actually, I'm a hardcore clinician. And you will realize that actually this did not start because I didn't want to do clinical medicine. In
Right.
fact, I wanted to do my clinical medicine a lot better than what I was actually allowed to do. The second thing is I've always understood, and I've always been someone who kept his eyes and ears open about what was happening around me.
Yeah.
I saw Amazon disrupting the world, or Apple, iPod coming and completely disrupting the music industry. I started thinking about what can we do for healthcare. This idea actually of the platform started with a very simple concept. I only wanted to make my own life easier. So I'll tell you
Right.
the original idea was, why don't you give me a single login, which will allow me to get data from all the sources for a single patient? But as we started thinking about it, we realized that actually this problem is far deeper than what I see. And I started analyzing exactly what is it that we really need to solve in healthcare. For the first time, I had a realization that the cruelest profession on this planet is healthcare. And I'll tell you why I say this. If I only keep my view on the people in front of me and ignore the suffering that happens purely because I'm not available somewhere else, that's a very limited perspective. And I started looking at what is healthcare availability in rural communities? How
Mm,
much does a person have to travel in order to see a specialist? I'll
mm.
give you a simple figure for Wales. Do you know what is the average distance traveled by anyone in Wales to see a specialist?
No.
63 kilometers
In Wales.
in Wales, part of United Kingdom.
Wow.
We've never ever sat down and started thinking about how can we make healthcare better? How can we heal healthcare?
Mm,
Healthcare is sick.
yeah.
And that is when the clinician inside me said, okay, now I have to not just do what I do, I have to start looking at how can I make the whole system easier, better.
Right.
So my core inspiration has always been how can we help people? But when I
Right.
started realizing that the current system is not designed correctly, I started looking outside the clinical world, outside what I would say the straitjacket, and explore areas which will help us make this better. So that is where the first concept of the healthcare data mobility platform came in.
Right.
We successfully deployed that. We did 10 million patient transactions. Then we realized, oh, hang on, this is really valuable. Now let's see what else can we do here.
Right.
That's when AI had just hit. Then we started integrating AI solutions on the back of the platform. And today I'm very proud to say that, listen, we have some very genuinely powerful solutions. So
Right.
if you say today that can we help primary care, the answer is yes. Can we help secondary care? The answer is yes. I don't need to
Can,
help
can
primary or
you
secondary care. I really need to help the patient.
Of course. I went onto Axon Care website and there were multiple products and services that you offer. So think about a bottleneck that we have just spoken about, whether it could be data, whether it could be time. Can you actually talk about one of your products that address these bottlenecks?
Again, let me see, this is a very classic assumption people make.
Hmm.
What you see on the front is a lot of products. The way I see it is one platform at the back.
Right.
So when you see lab link, a lab is connected to a patient's care.
Right.
When you see, let's say, a health ATM, that's connected to the patient. When you see CliniQ, that's connected to the patient. When you see the
Right.
patient care. So what you see at the front is merely access tools to connect to a common platform at the back end. And again, as I said, the core is to ensure that your up-to-date health records are available 24/7, 365 in any language. So even if you're traveling tomorrow to Moscow, you should not get into trouble. Or if
Right.
a Russian's in London, you should not get into trouble.
Right. Right. If
Language
it,
is one of the biggest barriers in healthcare.
yeah.
So that is again what something we've addressed already.
Of course. So let's think of it from a layman's perspective. And let me put a scenario in front of you. There is a hospital in the UK, and it has all the technology that Axon Care is providing. And then I come in as a patient. What is my experience going to be?
Okay, we already had a visit from Wales, and I'll tell you the fantastic experience was. So we've got a video testimonial about it. I'll give you a
Okay.
simple example.
Yeah.
Imagine walking into a hospital, not needing to stand in any queue, within a minute or two after your arrival, being seen by someone,
Within a minute.
within a minute
Okay.
or two, being
Okay.
seen by someone,
I'll give you 2 minutes. That's okay.
and at the end of 6 minutes, actually being told that wait for 4 more minutes and your medication is getting ready. You start taking the medication before you leave the hospital. And every time now we need you to do something, you'll get an alert on your phone. How magical would that be?
Wow. Wow. And
So,
blood test, Dr. Chapada?
so again, what does blood test is a phlebotomy, right?
Yeah.
Do you really need to do that much phlebotomy as we do today? The answer is no. If I have access to your background data and I know everything about you, I won't have to do so many blood tests.
Right.
Even if I have to do a blood test, taking blood or drawing blood should be a 1 minute job.
Yeah.
It's a 1 hour job if there's a queue. But what if I absolutely give you appointment? I even arrange your transport so you are at the gate at the right time.
Right.
And let me put it in practical terms. So the Welsh team came, they were not registered. From
Yeah.
registration to full discharge took them 16 minutes.
And what was the condition that this Welsh patient had, Dr.
It
Chapada?
was an endocrine condition for which they
Okay.
did the consult.
Right.
A
Right.
detailed consult, a detailed assessment, a
Yeah.
prescription, a blood test, and a registration, all within 16 minutes. It sounds
Within
impossible.
within 16 minutes. And
One,
just for comparison, if this person, the same person for the same condition, is to go today into a hospital and go down the traditional route, how long are we talking about?
we're talking the whole day, or at least half a day. I'll give you a very simple example. So you go to a hospital, let's assume you're not registered.
Yeah.
Now your registration process is going to take you at least 20 minutes, and usually much more than that because there's a queue. People are waiting.
Yeah. Yeah.
Now tell me one thing. Just because I stand in front of a receptionist, does my name or my address or my phone number or my insurance details change? No.
No. No.
So why can't I just have it on my app and just create a QR code and I scan and that's it? The data from my phone got transferred and everything's done. We did that.
The
So
technology exists. Yeah.
yeah, technology exists. The moment it's registered, now the next thing is I need to know about your history. What is it that brings you there? And I have to collect your medical. My AI bot immediately creates a questionnaire, and within the next 5 minutes, your detailed history is taken. The moment you have that, you are in front of an ATM, whereby
Right.
the remote doctor is actually examining you remotely because he can listen to your heart sounds or look you into your eyes or ears from 1,000 miles away. It doesn't matter.
Right.
In the next 3 minutes, he's finished his assessment, and now
Right.
he's actually writing a prescription, or rather creating a prescription, and lab
Right.
orders. And the local assistant is getting the phlebotomist in the room to say, hey, we need to do these 3 tests. Can you just draw
Right.
5 minutes of blood? The next 3 minutes, the patient is out.
Wow. So 24 hours has been reduced to 16 minutes through this process.
Yes.
Wow.
Finally, we have to think outside again. This is known as the Toyota principle. So before Toyota decided to put an assembly line, every car making used to take you several weeks. But then they realized, hang on, we just have to optimize the process in
Yeah.
such a way that everyone does their part very optimally. Ultimately,
Yeah.
you have to do the work anyway. You just have to do it optimally. And they brought down the time of creating an entire car from several weeks to 2 days. Within
Right.
2 days, the entire assembly was complete.
Mm. This is
We have
fascinating.
to learn from that part. Why do I have to do things that I don't need to do in a hospital? Believe you me, in the next few months, I'm pretty certain that we're going to have a phlebotomy robot. I might have actually, at the end of my assessment, I'll keep my hand out, and then the next 30 seconds, my blood will be drawn. That's it. Even today, when I do point of care testing at my health ATM, the results available in 3 minutes. Imagine if I have a serum troponin for your chest pain within 3 minutes. how many unnecessary hospital admissions are going to get saved?
Of course. Timing is everything in cardiology situations.
Yeah, but let's assume why cardiology? Let's assume you've gone and you've got a prosthetic issue.
Yeah.
And you get an ultrasound, and at the same time, within the next 2 minutes, I do a point of care blood test and tell you that the PSA is normal and the ultrasound is normal. Suddenly, I'm no longer worried about prostate cancer, am I? I
Of
don't have to
course.
wait for 3 days for my blood results to be available to tell me
Yeah.
that I'm okay. Because in those 3 days, I will not sleep.
Yes, the stress would be insane. So let me just rephrase what you said. So I'm a patient and I have some endocrine issue. I go into the hospital. I have a QR code with all my details on my smartphone. I scan that. That tells the doctor that I am in. And then I go to this AI bot that basically takes all of my past history. Then I go to this ATM type system, which
You
instead
can
of
either
taking
say a
one,
real doctor or the ATM. So the whole idea here is you don't need to have every doctor in your hospital.
right,
So
right,
let's assume my hospital only has 3 doctors and I
right,
need to see a fourth specialist. He's immediately available there because my data has already gone to him. He can already see what my history is, what my
right,
findings are, what my background is, and he's doing a remote assessment.
right. Wow. And then that person does the diagnosis. If you need bloods gets done, scripts get written, and the person is out the door. An entire process, you're saying,
Yes.
takes 16 minutes.
Yes. And we've
Insane.
shown this. Again, you might say, in UK, we might. So 16 minutes is what we've achieved. That doesn't mean that I will always say, put it this way, that most of the patients will be out within 20 minutes.
Wow.
There will be that occasional patient who needs a lot more attention, who might need a hoist, who
Yes.
might need
Yeah,
to be
yeah, yeah,
examined.
yeah.
So I'm a bit cautious about making claims that I can't
Of
sustain
course.
for 100%.
Of course. Of
But
course.
if I see 10 patients for 16 minutes each, where the actual consult is only 4 minutes, when I'm
Mm.
examining the patient. Today, I take 20 minutes to see one patient, so I can see 5 times as many patients.
Of course.
So suddenly I'm equivalent to 5 specialists.
Of course, that solves the time issues. I mean, what you say makes so much sense. And I'm assuming that you have pitched this idea to the decisions maker in the NHS. Like, what are the biggest challenges that you currently see in bringing these AI solutions into a complex system like NHS?
So I don't think there's any major challenge. It's all about visibility. So actually, we've started a UK journey only recently. So we just need to make our solution visible, demonstrate its efficacy, and I'm pretty certain it'll get taken. So I always believe that you have to prove whatever you say. It's very easy to talk.
Of
It's very
course,
difficult to show.
of course.
And that's where, I think it's only a matter of time. And we will be actually showcasing most of our products inside the NHS family.
Where do you see Axon healthcare or AI in healthcare more broadly in the coming 3 to 5 years?
Difficult question for me to answer at this stage. Let
Make
me
a
put it this way.
prediction. Make a
If
bold
I
prediction.
dream it correctly, I expect it to kind of start being the go-to solution from a healthcare clinician's perspective. Because ultimately, I'll tell you, when you look at healthcare, you should not think about a patient or the doctor separately.
Right.
Healthcare is not the doctor or the patient separately.
Right.
Everything in healthcare happens when the doctor interacts with the patient.
Right.
So there's only one unit I empower, that's the doctor-patient interaction. And I want to be the tool for a DPI.
Right. So I'm assuming in future you are going to have these AI agents. So a patient's going to have a smartphone with AI integrated into it, and then a doctor in the hospital is going to have maybe a phone or a live dashboard, and people would be able to communicate and interact with each other in real time. Data will be updated in real time, and decisions will be made in real time, not on Monday to Friday, 9 to 5. Would that be correct?
Yeah, but let's again understand it slightly differently.
Okay.
Healthcare is going to shift from diagnostics in the hospital, intervention only inside the hospital.
Mm,
So I will never go to a
mm,
hospital. So we
mm.
already have built a personal doctor on your phone. So can you imagine now that I can actually give you a doctor who knows everything about you, who you can talk 24/7 with,
Mm.
and who will tell you when you need to see a real doctor?
Wow.
Because at some stage you might need to see a real doctor.
Mm.
But if 80% of my problem is solved, with my phone alone, then the pressure on the system is going to disappear. That's going to free up real doctors to do a lot of things that currently is not being done.
Exactly. So the
As
main,
diagnostics starts happening in the community,
yeah.
the only thing that I'll have to go to a hospital is when something needs to happen to me, which is intervention.
And that will eventually bring the initial question I ask of waiting times dramatically
Absolutely.
reducing of the surgeries,
Yes.
like for instance, that what we are talking about. So
Correct.
basically, the future is bright. It's not all doom and gloom. NHS is not
No,
collapsing. It just needs to catch up with Dr. Chapada's vision, basically.
not necessarily my vision. I'm sure most of my colleagues will agree with what we're doing.
I
Because
think they
I
will.
see the future as being very patient centric.
Of course. Amazing. Dr. Shibata, I've got two more questions for you, but they are slightly personal questions. I did some Googling on you. You are a surgeon, you run companies, you teach on YouTube with your channel, Health Talk with Gastrosurgery, you volunteer your expertise to hospitals, non-profits. What keeps you going?
Actually, okay, you can call me a restless soul, but they're all driven by that same thing. So, as I told you, I'm a clinician at core, and what drives me is the ability to do something good for someone, right? So,
Right,
when you look at all these roles from a perspective of, am I doing something worthwhile? Then the
right.
answer comes, very unique. So, if I'm doing a YouTube video,
Yeah,
what am I really trying to do? I'm trying to help people who are worried for that problem. When I'm
right.
volunteering, I'm trying to again do the same. So I always feel that, listen, every human always tries to find a purpose, and his purpose is very ingrained with his identity. By God's
Well,
grace, life has been very kind to me. When I look at my journey so far,
yeah.
I feel that I've always got more than what I deserved.
Wow.
So now is the time to start thinking about, okay, hang on, what can you contribute?
Mm,
And that kind of keeps me going. So let
mm.
me put it till 2017, I was almost a full-time 16 hours a day surgeon. But once I decided to do what I'm doing currently, I realized that I have to give a lot of time,
Yeah.
look at the system and transform it. Yeah, I'm 24/7 still a clinician. I'm only looking at systems which will make my clinical life better.
No, like every great intervention started with how can I make a product that's going to make my life better? And then next thing you know is people share best practices and things go viral.
Yep.
So I just have nothing but good things to say about Axon Care. Like I saw the website and I saw the products and they look incredible. And it's not just something that you're claiming. I think there are videos of you showing it in real time of how does the system work and how does it impact a patient's life. I hope the key decision makers can see it and try and cut the red tapes so that these things can come in as quickly as possible to eventually help as many people as possible. Dr. Spada, it was great talking to you. Last part of this podcast is I call it Dose of Health. And I ask this question to everybody, and I'm going to ask you as well. If I give you a magic wand called Dose of Health, and you can wave and change one thing in your field, what would that be?
Okay, you're asking me about one thing, though I can think about so many things. But the one thing I definitely want every single clinician to start looking at, and I'll say introspection about the system itself. We have been
Mm,
trained to only look at our patients as our responsibility,
mm,
ignoring very much that that patient exists in a family and a social structure that depends on.
mm,
So the moment we become socially aware
mm,
of the consequences of our availability or a non-availability,
mm,
I think healthcare will become extremely innovative. Every doctor is inherently completely capable of transforming this whole system.
mm.
And when I look at engineering today, we've managed to reach the moon because the engineers were restless.
Yeah.
I want doctors to be that restless. And I'm
Mm,
sure we'll achieve miracles.
mm,
Miracles we
mm,
can't even think about today.
mm. Be the change you're asking for. That's what you're saying. Amazing. Dr. Chapada, I need to give you your flowers, and I want to go on record that you're currently in India and it is, what time is it there?
Just
Half?
midnight.
It's 12 o'clock and you just finished your clinic, and I asked you to come online at 11 p.m. and you had this long day, but you still gave me an hour. I'm forever grateful to you, Dr. Chapada, and keep doing what you're doing. We need more doctors like you. Thank you so much.
Thank you. Thank you for inviting me. And it's been a pleasure.
Amazing. Amazing. Take care. Take care, Dr. Chapada.
Take care. Bye bye.
Okay.